This committee has seen some partisan battles in the recent past. We've been able to set those differences aside on several bipartisan bills that have potentially become law, I think, create jobs and can happen this year. And I hope we'll move forward and focus really on results instead of politics. Members of this committee and Senator Reid and McConnell, I look forward to working with to put together a bill, passing it on the floor, and I'm confident with some strong leadership we can get a package of legislation signed by the President. It's good to see Senator Toomey here. We've been working on legislation since July when I had a access to capital hearing in my Economic Policy Subcommittee. The key takeaway from that hearing was we need to ensure the capital markets remain within the reach of startups at various stages of their development, particularly in the stages before they're ready to go public. As a result of that hearing, we had a chance to take a closer look at updating Regulation A and better enable small businesses, including many of the innovative biotech firms in Montana and Pennsylvania and around the country, to raise capital through these public offerings. These capital-intensive firms face unique challenges in raising the significant amounts of money necessary to complete clinical trials and complete development of cutting-edge drugs. Mr. Waddell talked about that in his testimony, and I appreciate the partnership we've had working on this bill. A bill that passed the House 420 to 1. It makes a number of updates to Regulation A, increasing the amount of capital that can be raised through these offerings to $50 million, while providing a host of new additional investor protections that include a requirement of annual audit financial statements and the bill provides the SEC with the ability to require issuers to provide additional information regarding the financial condition of businesses to prohibit bad actors from participating in such offerings. The bill maintains the most attractive elements of Regulation A, including the ability of issuers to test the waters before registering with the SEC and preserves a non-restrictive status of securities sold through Regulation A offerings, a bill that, along with many others that I hope we can get passed here in the United States Senate. My first question is for Mr. Waddell. In your testimony, you talk about the opportunity that modifications of Regulation A present to start-up biotech firms. Can you talk a little bit about how and at what stage of development a firm like yours might use Regulation A and what an adjustment of that cap from $5 million to $50 million might mean for your company?
Certainly. Oncomed is a biotechnology company. We're doing discovery and development work on cancer therapies. We are currently in clinical trials. Clinical trials are extraordinarily expensive. For every patient that's in a phase 1, and there are 3 phases of the clinical trial process, every patient that's in phase 1 is approximately $50,000. Get to phase 2, it gets to be about $75,000. So to access $50 million, when I look at my company's plans, that would get me from discovery for a therapy to the end of phase 2. Now, the end of phase 2 is a very important marker and milestone, because that's when you reach what we call proof of concept, where you've shown that your drug has potential to move forward into phase 3, but the science that you've been working on for a number of years has gotten to that point. Now, in terms of would my company try and access $50 million time and time again, the answer is no, because what I have to be cognizant of is when I raise $50 million, my previous shareholders are getting diluted a little bit. They own a little bit less of the company when I raise that money. So we try to be very strategic when trying to go for those sums of money and direct them specifically to what we think are the promising therapies within our pipeline.
You've been, I think it was your testimony also said, and it was 1992, it was set at $5 million. And I don't know how long you've been in the business, pharmaceutical business, but
20 years.
Well, we're there then, yeah. 1992.
Yeah.
What kind of, how have the costs increased since then? In other words, $5 million, I would imagine in 92, as an agriculture bought you a hell of a lot more than it's going to buy you today.
Yeah, absolutely. I mean, the difference being, and this gets a little complex, is that the recognition in the marketplace of what is valuable has changed.
Yeah.
So back in the 90s, when I first got into biotechnology, you could have $5 million, go for a couple of years, and shareholders would respond to the value you created with $5 million. That has changed dramatically in that you have to not go from just discovery, but all the way to the end of phase 2 before they'll look at you.
Gotcha.
You know, and that's, I mean, that's a key understanding in all of this, that the data that flows through my financial statements talk about what's going on financially in the company. We disclose everything appropriately, but the science underlying it is really as important, if not more important.
Just a little liberty, Mr. Chairman. You can make this question very, very concise if you would. There is some anticipation that people would use this offering multiple times.
Mm-hmm.
Could you talk about that very briefly, if you see that as something that your company would do, or if it's something we need to be concerned about?
No, that would be dilutive to my current shareholders, and I wouldn't have a job.
Gotcha. Thank you very much. Thank you, Mr. Chairman.